Welcome to plenary session number 1. My name is David Heyman, and I'm very pleased to be chairing this panel session, which will be 4 different chairs who have been running parallel sessions over the previous weeks through webinars. This session is about what the world has learned and what it is learning from the COVID-19 pandemic. And what we're learning, we must be sure, results in benefits that we can share equitably across the globe. As I said, this session will summarize 4 different topics: governance, communication, socioeconomic impact, and preparedness. And the 4 chairs will share with us the important lessons they learned during the webinars that they chaired. They will then tell us about their recommendations for the future, and finally outline some concrete actions to ensure that these recommendations might be implemented. We will begin with, in just a few minutes, with the panel, but before that, I must give you apologies for Dr. Liu, who's unable to be with us today because of some activities that she has in the emergency department in the hospital where she's working in Montreal. So I'd like to just start this session by moving to the first speaker being Dr. Mandeep, who will speak with us about the webinar that she chaired. Mandeep, over to you.
Thank you, everyone. It's a pleasure to be here with you this morning. And it was a real pleasure to chair and moderate this important session, which was the webinar that was developed by UNFPA, the People's Health Movement, UNICEF, and UNDP on the socioeconomic impacts of COVID. And we looked at things from an equity perspective. The COVID-19 pandemic is both a public health and development crisis. What started as a localized health outbreak quickly escalated into a global development crisis of unprecedented magnitude. Measures to prevent, manage, and contain COVID have triggered far-reaching socioeconomic consequences across the development landscape, ranging from poverty, hunger, education, gender, livelihoods and economy, to inequality and human rights violations. And these socioeconomic impacts are reversing years of development gains, driving people back into poverty and threatening progress towards the Sustainable Development Goals. Last year, for example, the world witnessed the first increase in global poverty since 1998, driving as many as 100 million people into extreme poverty. The ongoing pandemic is also characterized by uncertainty. However, what is certain is that marginalized communities are disproportionately affected by both the health risks as well as the socioeconomic fallout of the pandemic. The pandemic acts as an amplifier and an accelerator of existing injustice and struggles that they face by being marginalized. At the margins of global attention to the exciting science on vaccines and treatment for COVID, we have seen so many stories of socioeconomic injustice. These include violence against women, human rights violations against LGBTI people as the scapegoats for COVID-19 spread, the exclusion of people with disabilities from COVID responses, exploitation of migrant workers, and many other socioeconomic struggles among marginalized populations. These injustices and inequities can also elevate COVID-19 and development risks for themselves as well as for society as a whole. The stories and realities of marginalized communities must be brought to the fore for global attention and action. We have learned from the AIDS response that the key to success is listening to the voices of the marginalized and placing them at the center of the response. So what exactly are we learning from these stories? Well, we're learning that we need to understand and really unpack the different socioeconomic impacts among different vulnerable populations at different locations. So for example, vulnerable groups such as women, female-headed households, and households with persons with disabilities have been hit particularly hard by the pandemic, and they're already being left behind in responses, making their resilience to future shocks already challenging. It's important to note that these intersecting inequalities and marginalization makes the response to COVID even more challenging for these populations. The pandemic has magnified existing challenges such as discrimination and exclusion from equitable access to essential services, and we're certainly seeing this play out in the global discussions around vaccines, but essential services such as healthcare, education, and social protection. However, the voices and realities of persons with disabilities are certainly not sufficiently reflected in COVID-19 responses and recovery plans, including those of the UN system. We also learned that COVID-19 is really exposing pre-existing inequalities and injustices, including patriarchal norms, and has aggravated the impacts on vulnerable groups. These include migrants, women and girls, religious minorities, ethnic minorities, people with disabilities, as I previously mentioned, sex workers, LGBTI, but particularly transgender people, among others. The plight of migrant workers in India, people who lost their jobs, was highlighted by one of the webinar participants. We also really heard, could we go to the next slide, please, how it's really important to use data to have pro-equity responses. We heard from a presenter from the University of Oxford about how the pandemic is projected to delay progress in reducing multidimensional poverty, which factors in a broad range of deprivations, including health, education, and access to living essentials like water, electricity, and housing. Some governments are using the multidimensional poverty data for pro-equity COVID responses. They identify and target households at the greatest risk of being left further behind due to the combined effects of COVID and multidimensional poverty. We also heard how extraordinary situations like the current pandemic can offer extraordinary opportunities for reducing both multidimensional poverty and inequities. For example, in Sierra Leone, they achieved a significant reduction in multidimensional poverty during and post the Ebola epidemic. We also had very interesting discussions on how the pandemic can be used to promote greater inclusion and empowerment of marginalized communities and greater health and socioeconomic equity. So what do we need to do? We need to strengthen social protection systems. And this is something that resonated very strongly. And one of the things that the pandemic has exposed is the fragility of our social protection systems. We need to really look at the gaps in certain populations and the gap in social protection systems, and incorporate systematically the equity lens in social protection planning to ensure that special attention is paid and we have dedicated investments to meet the needs of the most marginalized. And to do that, we also need much better data to be able to drive equity and inclusion in a way so that we are able to strengthen systems. I'd like to add that there are some good examples which exist. For example, Thailand's extending health coverage to migrant workers, including undocumented workers, as well as the Indian government establishing mechanisms designed to assist the transgender community with social protection schemes and their legal rights. Secondly, pro-equity social protection requires robust governance. It requires political will backed by evidence, community engagement, and an integrated approach that links relevant stakeholders, sectors, and issues. Marginalized communities can also provide the ground realities that offer sustainable solutions and connect the dots across these various things. Governance must be grounded in the principle of equity and engagement of the most vulnerable as change agents. This is the only way we will enhance security and resilience of society as a whole, as we've witnessed in the battle against HIV. Finally, the COVID-19 pandemic has revealed how countries still remain far from fulfilling their SDG pledge of leaving no one behind. We have less than 10 years left to the deadline of 2030, and the ongoing pandemic compels extraordinary responses that leave no one behind and really reach those furthest behind first. The pandemic has undeniably demonstrated that we are as vulnerable as the most vulnerable in our societies. Pursuing a pro-equity approach by reaching the furthest behind first can simultaneously strengthen COVID-19 responses and accelerate the progress towards achieving the SDGs. Could I have the next slide, please? So what do we really need to do? We need pro-equity investments, policies, and systems. We should use this pandemic as an opportunity to build a fairer and safer world with greater solidarity. Reach those furthest behind first. We need to expand collaboration and partnerships. This pandemic has shown us that it's not the responsibility of the health sector alone to respond to a pandemic such as COVID-19. We need to expand collaborations and partnerships in a very concrete way and use data which is readily available to drive equity and impact. And I'd like to conclude with a quote that was shared, which our colleague from Oxford referred to. We have a once-in-a-generation chance to build a safer and fairer world. Let's not waste it. Thank you very much.
Thank you very much, Mandeep, for that very concise description of your webinar, pointing out the different impacts in different populations and also the inequalities that can cause. And in addition, the need for better social protection and data, and moving forward partnerships and more solidarity globally in order to deal with this pandemic. Very clear, very concise summary. Thanks again. And to our audience, there will be a time at the end of the 4 presentations for questions and answers, and you will have the opportunity to ask your question verbally. If you put your name in the chat box and your question, we will then pick out the questions and call on you. So next, I'd like to turn to Sylvie Briand from WHO to talk with us about her webinar. So over to you, Sylvie.
Good morning, good afternoon, and good evening. So I and would like first to thank the PMAC organizer for giving us the opportunity to have those very important and interesting discussion. First, I would like just to highlight that our webinar was bringing together different type of expertise. We had public health practitioners, journalists, scientists, and so this enabled us to cover the subject from a very different perspective and point of view. So first, let me describe what is infodemic, because many of us may not have the same definition of it. An infodemic is a tsunami of information, some accurate, some not, that goes alongside a disease outbreak. So it's a special phenomenon. It's not a new phenomenon, because we see this with every outbreak or every epidemic or pandemic. But really what has happened during COVID-19 pandemic was really an unprecedented phenomenon and event. And even if we have seen this, for example, with Ebola in 2014, well, there was, for instance, rumors that when people were going to the Ebola treatment center, in fact, they were killed and their organs were taken to be sent away to rich countries. But this kind of rumors usually remain localized. But with the COVID-19 pandemic, we have seen those rumors and misinformation spread very far and very fast. And this has been really a concern because we know that now in the world, more than 55% of the population has access to internet. So most of us will live in 2 worlds. We live in a virtual world where we communicate, and we live also in a physical world where we communicate as well. And those 2 worlds are not separated. There are bridges between those 2 worlds. And this new phenomenon is something that has come with the new technologies as well. And unfortunately, we are just at the beginning, and we don't understand really for the infodemic how it spread and how to manage it as well. The second phenomenon that is really specific to this pandemic is the fact that science evolves faster than ever as well. First, COVID-19 was a new disease, so initially we didn't know much. Now we know a lot more, and science has evolved extremely fast, because you have seen that we have been able to have a vaccine in 1 year. Which is really also a completely new feature of developing medical countermeasures. But science goes fast as well, because we have seen in previous outbreaks or epidemics or pandemics that science pace is usually quite slow. And sometimes we had been waiting for publication and very important data for 1-2 years, and sometimes even the publication comes after the outbreak or the pandemic. So this time, in order to counter this, there have been a lot of platforms online where you can do a preprint publication and share the results before those are completely final. So this is great because you can access the science much faster. But the problem is that sometimes you have preliminary data or conclusion that are taken as final results and lead to wrong interpretations. The second thing that is also very much linked to the new technologies as well is the fact that you can have scientific debates in the public sphere and real time as well. And we have seen that many scientists now are using Twitter or other type of platform to share their results. And so this is great because many people have access to them as well. But also it brings to the public debates and discussion between peers that may also lead journalists, for instance, to the wrong interpretation of the results or the data. And finally, this science in public, I would say, has led also to the emergence of a number of new experts, which, I mean, some of them are not really experts in the field of infectious disease, vaccines, or relevant topic for COVID-19. But then suddenly, because they have time, because they speak well, and sometimes because they also like to be visible, we have seen the growth of many new experts. Some are really good, others are not so good. And this also has brought some confusion in the scientific field. So what we have seen during this pandemic as well is that infodemic has a significant impact. And that's why we cannot ignore it. We have really to manage it. We cannot eliminate it either. Some people have tried to do this in the past, but it doesn't work. So really, a sound infodemic management is the way forward, but it's very complicated. And one of the impact, for example, of infodemic is a direct impact on the disease. We have seen, for instance, in Iran, more than 400 deaths of people due to the methanol, because this was promoted as a miracle cure for COVID-19. But in reality, it's a poison. And many people believing that this was a cure, in reality died from methanol. We have seen also in other places healthcare workers being attacked because there was rumors that healthcare workers were the ones transmitting the disease. And so it can really has an impact on the response, on the responders as well. And we have seen also a lot of polemic around masks, vaccines, certain treatment like hydroxychloroquines. And this has led to a real polarization of opinion around those interventions and has not helped the response at all. But what we have seen as well during this pandemic is that infodemic has impact beyond health. It has undermined in many places the trust in the government, in the institution, in the science, and has fostered a number of divides in the society through stigma or other increased inequities. And these are effects that may last longer than this pandemic, and as also may have impact also on democracy and other ways of being in societies. We learned as well during this pandemic that everyone has a role to play in infodemic management, and that a good infodemic management requires a multi-sectoral and a whole of society approach, meaning that everyone, whether the government, academia, journalists, communities, individuals, everyone has some role to play. But what role? And this is what we need to define further. So in a nutshell, I think we are facing really a new area, with a new era, which brings a lot of opportunities. For example, internet allow us to spread good information around the world, to share very quickly new scientific findings, and also allow people to communicate better. However, it also brings some challenges. And for instance, we have seen that on social media platform, the algorithms that are used to usually for commercial purposes may in fact propose to people always the same type of information and create some kind of echo chamber that can lead also to a bias in the access to information for some people. So we need to really balance the opportunities and the challenges that in the world we are living. And this is what we can do for getting better prepared for the next pandemic. So some recommendation that came out of the panel was first that community needs to be engaged and empowered. And there is no way to respond to an epidemic or a pandemic without including communities. And so we have had some example, for instance, with the youth community, where youth are impacted by lockdowns in many places, but they are much less impacted by the disease. So for them, it's really hard to put in place the precautionary measures and to accept also the measures that really change completely their own life. So how to convey the message to youth and how to make sure they implement the interventions correctly. So we have learned that we need to work with them, define what are the messages that are receivable for them and how they can contribute to implement them and to share them with their peers. So really what we have learned during this pandemic is the importance of co-development of guidance, recommendation, and co-implementation as well of measures. It's not anymore the health authorities that say to the population what to do, but the health authorities have to engage with the rest of the society to make sure that this is done together and taking into account the concerns, but also the limitation of certain groups to implement certain measures. The second thing, which is really important, is to improve science communication in times of crisis. Now, scientific people, scientific community and scientists are really key players in the epidemic and pandemic response. So they should be engaged as any other communities, but they should learn also how to play this role during crisis. And so they need also to maintain their good code of conduct, recognize their social responsibility, and engage also with the public in a two-way conversation and less than expert to lay people conversation, but really more equitable conversation. And we need also to overcome the natural competition that exists in the scientific world to enhance more collaboration. And we have to say that since the beginning of the pandemic, we have seen a fantastic collaboration among different experts in the world. And we have set up networks of expertise that are working extremely well. So I think this also gives a lot of hope about how to integrate science into a future response. Third, we need to protect health and society by improving resilience to mis and disinformation. We have observed that during a pandemic situation, there is a lot of fear and anxiety. And when there is fear and anxiety, people are much more vulnerable to misinformation and disinformation. And we have seen that some rumors spread even faster and use even channels that are not used, channels that are not used usually to spread this information. So we need in peacetime to increase this resilience so that for the next pandemic, people can really be more equipped to analyze the information and stop the spread of mis and disinformation that can be harmful to their health. Finally, we have really tried a lot of ways to really manage infodemic during this pandemic, but we need to move from ad hoc interventions and trials and error approach to a more systemic approach. We need first to have a comprehensive plan to manage infodemic. We need to have a workforce that is really well trained to do so. We need legal frameworks that allow us to work with, for instance, social media platforms and find ways to promote accurate information over myth or disinformation. We need partnerships with whole societies of stakeholders. We need tools such as fact checkers, for instance. We need also better data to monitor infodemic. And we need also an assessment of risk communication systems on how they can contribute to manage this new phenomenon. So concrete action, what is needed? We think that we need a science and a scientific approach to infodemic. We have, with many scientists around the world, create the infodemiology, which is a science that will enable us to better understand infodemic, but also to better manage it with evidence-based interventions. And this infodemiology brings together experts from many disciplines, mathematics, physics, chemistry, data science, social science, communication experts, public health practitioners, doctors, nurses, anybody who can really bring something to the table to better understand what is infodemic and how we can better manage it. So we have already some academic institutions ready to create PhD and masters on infodemic management. Then within the workforce, because now, for example, risk communication and community engagement cannot only be in the physical world. We have to do it in the virtual world as well and understand the bridges between those two worlds. So we have also developed a training for, now we have 280 infodemic managers around the world, but we need more people engaged in this. We need also innovative tools. Some tools now are developed to do social media listening, understand what is the intensity of discussion around certain topics. We have also the capacity to measure the population sentiment and knowing if people are hungry, if people are fearful, or if people are happy with the intervention. And this helps a lot to also convey the right message at the right time. We need also stakeholder engagement because, as I mentioned before, we need everybody on board to manage infodemic. And we have issued a call to action that you can find at these links, and you can join this movement for a better infodemic management. And finally, we have, thanks to the many scientists around the world, develop an infodemic research agenda that will be published very soon on WHO website and on the website of the other UN agency that have rallied the call to action.
Thanks very much, Sylvie, for a very clear presentation on infodemics, a new term that's gradually entering public parlance, really. And you've clearly shown us the positive and the negative about this wide flow of information and how important it is to really manage it properly and to get all disciplines together to solve the problem and eventually train people in how to deal with infodemics. So thanks very much for that presentation. Very clear, very concise recommendations. Again, to the audience, please continue to send your questions and answers. Answers will be given during the question and answer period after the four panelists have concluded. And now I'd turn over to our next panelist, who's Ian Smith, who comes from the World Health Organization as well. Ian, over to you.
Good morning and good afternoon and good evening all. And I should first of all clarify that I'm presenting this brief summary of the discussions from our webinar on lessons for preparedness. Is there a recipe for success? I'm sharing this on behalf of Mr. El-Hajj Assi, the co-chair of the Global Preparedness Monitoring Board, who chaired this webinar. And I'd also like to acknowledge the contribution of Padma Shetty from USAID, with whom we partnered in organizing the webinar. And the session addressed four of the issues that have been identified by the Global Preparedness Monitoring Board in their 2020 report, A World at Risk, as demanding urgent attention. That is, the human dimensions of preparedness, i.e. responsible leadership and engaged citizenship. Secondly, sustainable financing. Third, effective governance and coordination of systems. And finally, measurement of progress. The panel members highlighted several lessons learned from the COVID-19 pandemic, and I think you'll find that they are consistent with what you've already heard from the first two speakers. They noted the importance of clear, timely messaging and successful communications between leaders and communities, and that this had been a real strength in many countries which had fared better in the COVID-19 response. Good communications coexisted with trust, and trust was earned by leaders who acted and spoke with honesty, integrity, humility, based on science and evidence, leaders who were open about what they knew and what they didn't know, and who delivered on their promises. Second, COVID-19 has thrived on and deepened inequity. The panel noted the importance of social protection mechanisms and gave examples of effective policy responses that have targeted inequity, such as providing unemployment benefits, small grants to small businesses to balance out negative impacts of the pandemic, and measures to facilitate access to healthcare. Thirdly, the panelists shared ways in which the pandemic has led to new ways of working together, giving some examples. Government finance ministers attending health investment meetings with unprecedented interest under a fresh realization that health is a socioeconomic concern. Development banks working together to devise multi-billion-dollar financial packages to enable vaccine procurement, and researchers and companies and donors collaborating together on R&D, shortening the time to develop a vaccine from years down to just a few months. However, that same collaboration has been nowhere near as successful in ensuring equitable access to these vaccines. Collaboration for innovation has been much more successful than collaboration for access. And the pandemic has made it clear that we must strengthen collaboration at all levels, but that future coordination needs to be stronger, more agile, more targeted, better targeted, and based on principles of equity and solidarity. Fourth, the pandemic has shown that measures of capacity and capability do not necessarily predict a successful response. Some countries with high capacity and capability ratings have performed relatively poorly in containing COVID-19, and conversely, others with apparently lower capacity have mounted a better response. And finally, the panelists noted how many other factors had influenced the response, from leadership to community preparedness and of course, financing and coordination. All of these, in fact, are actually inseparable. We need to better capture and interrogate these factors for future benefit. Panelists made several recommendations for better preparedness and response. First of all, pandemics begin and end in communities, and for future preparedness, we must focus on building community relationships and resilience based on foundations of trust and accountability. And we need a very strong focus on reaching and supporting vulnerable and marginalized groups who often face stigma, discrimination, often lack access to resources and information, and frequently live in conditions that are challenging for sustaining effective public health measures. Building an early foundation of trust through engagement with communities is essential. Secondly, health and economy are intertwined. It's not a trade-off. Where investment has been made in building resilient communities and strong healthcare systems, the economic impacts of this pandemic have been better contained and mitigated. Widespread investment in public health systems based on primary healthcare and universal health coverage must begin now. Better does not always have to mean more. in the context of preparedness investment, though. And we need to support countries to make the existing resources go further through strategic health investments. Fourth, we need much more effective collaboration. Previous world events have resulted in the establishment of much of the international institutional architecture. For example, the foundation of the UN following World War II and the establishment of UNAIDS and the Global Fund in response to the HIV/AIDS crisis. But we don't necessarily need new institutions. We need systems in place that ensure that the institutions we have are empowered to work effectively and that countries commit to greater preparedness. We also need cross-sectoral collaboration to facilitate further the research and development and distribution of countermeasures in the event of future outbreaks and pandemics. And we therefore need a framework for prioritization of shared resources, including vaccines. Finally, we must build systems to capture what we have learned from the COVID-19 response, remembering that very often the best predictor of future performance is actually past performance. So shared systems are needed to capture, to manage, and to interpret data at all levels, including invaluable community level data. Finally, what's needed? Well, reforms are needed deep and wide for preparedness. However, the panel focused really on concluding thoughts on the spirit in which we must approach this task. Firstly, we must learn from success, looking across countries and across sectors. It was noted that disaster management teams in lower income countries frequently demonstrate a clarity of purpose in disaster response that we could do well to study further in respect of future preparedness. Second, we must also, though, learn from failure, from failures of COVID-19, approaching this with a degree of humility and determination rather than despair. Many countries that succeeded this time round did so because they had failed in a previous outbreak or pandemic. And we must utilize COVID-19 as a chance to open ourselves to new perspectives and an opportunity to improve governance and systems at a community, national, and global level. It's our best chance to ensure we're not in this position again. But it must be said, in learning from successes and failures, we must make sure we do not focus our attention solely on this most recent pandemic. Far too many solutions have been designed around the last crisis rather than the next one. And finally, and perhaps most importantly, we must look to people. Building on the billions of acts of kindness widely evidenced in this pandemic, we must strengthen volunteerism, enable and provide training and support for volunteers to strengthen the community response for preparedness and the response to future shocks. And we must clarify and strengthen the shared responsibilities of leaders and communities in pandemic preparedness and response.
Thanks very much, Ian, for reminding us about the importance of trust, of collaboration, especially in getting the goods that we have seen so rapidly developed out to people, the importance of communities and the importance of really beginning to think more about universal health coverage, as have many countries in the world that have shown that there is resilience in UHC. So I'd like to now turn to our last speaker, who's Ilona Kickbush, many of you will know. Ilona is from the Graduate Institute in Geneva. So over to you, Ilona, for your intervention.
Good morning, good afternoon, good evening to all of you. And I will report on the panel that was called Governing for Public Health and Pandemic Preparedness. I think probably we would have, after our discussion, added another word in that title, probably saying governance and politics for public health and pandemic preparedness, because a lot of our discussion referred particularly to that political dimension that we have experienced over the last year. Just to say that we had a fantastic panel, which included Dr. Hans Kluge, the regional director of the WHO European office. We had our colleague Magda Robalo, who is now the High Commissioner for COVID-19 in Guinea-Bissau. And we had with us from Japan, Yasuhiro Suzuki, who is also a member of the Global Preparedness Monitoring Board. And so it will come as no surprise to you that some of the recommendations in this panel on governance also reflect some of the points that Ian Smith has just raised in his presentation. But I think, hearing that there is consensus among top-level experts is an important message in itself. Let's not forget that we're nearly exactly 1 year now from when the WHO issued a warning when it declared the public health emergency of international concern. And one of the things we have clearly learned, and Ian has alluded to it, is that our measures of preparedness do not include the analyses that pandemics are highly political and highly politicized. And we have found, and there have been increased involvement of political analysts and political scientists who show us how politics have hampered the development and the implementation of evidence-based policies. And we have seen also how the actions of one country could have profound consequences on the actions of another, or we might say of a whole group of countries. And of course, throughout 2020, the world was challenged by one of the global powers, the United States, who was not committed to the multilateral system and made it difficult to move forward with a collective international response. It left the pandemic response fragmented and uncoordinated. And this is a legacy that we are fighting with to this day, and is now being increased through the race for vaccines that we are experiencing around the world. So the present geopolitical situation, and that is something the panel alluded to repeatedly, makes it very difficult to get collective action, the type of collective action that we need in order to move forward. And so the general crises of multilateralism, as some people call it, also reflects itself in global health. And 2021 needs to be the year where we re-establish a strong multilateralism for health. So what are some of the lessons? There are some that have been put together on the slide. If we could have the next slide, please. Do they move? Yes. So we have seen clearly that we have hampered our response through this high political approach to the pandemic that has been influenced and by border closures, by regionalizing global supply chains, and by encouragement of unilateralism and narrow nationalism. And we can see that even though there was a lot of talk about global solidarity, about global public goods, we are not seeing that turn into practice. So one of the lessons, of course, is that we need to reflect on the geopolitical and the political economy aspects of this crisis, and see what parts and what elements of the global system we need to reform in order that we can have better collaboration. Given that the WHO is as strong as the power it receives from its member states, we need to reflect in what way that organization can be strengthened to the extent to which it can be more independent, and how we can get a better implementation of the international health regulations. And many of you who are involved in this know that at present there is a range of initiatives from member states to discuss how WHO can be reformed, how it can be better financed, and in what way the international health regulations can be better implemented. This is absolutely essential, and Ian has already alluded to it. The next global hazard is around the corner, and many of you know that it might not be a classic pandemic, but it actually might be a crisis of antimicrobial resistance around the world. We heard that there was a strong need to build strong regional systems. So we heard how the establishment of the African CDC has proved to be absolutely essential for the response to the COVID-19 pandemic. We heard from Europe how the European CDC needs to be strengthened, and there were initiatives to build a European health union. And we heard from Asia that there were discussions in ASEAN to see the extent to which an Asian CDC could be established, and then that a strong link between these various CDCs can help at the technical level and at the information level to support us in any kind of similar outbreak. We've also learned, and I think nearly every other panel has said this, that the governance is needed at all levels. We've seen the importance of cities in the response to COVID-19, but we've also learned that the public sector cannot deal with this crisis alone. It needs the involvement of the community itself. It needs the business sector. It needs a range of public-private partnerships. Again, we've seen that at the global level in the context of the ACT Accelerator. We see the WEF discussing issues of greater preparedness. But indeed, at local level, the way business is involved, the way workers are protected, the way the health workforce itself is protected is absolutely critical. We try to look a little bit into the future of pandemic preparedness and response, and some of the lessons that we could take forward as recommendations. If we can have the next slide, please. This, of course, is already what I've alluded to, how one can improve the involvement of non-state and subnational actors. And we have found in experience, and we heard that from a number of the panelists, that particularly countries that were decentralized, where the responsibility for health, where the responsibility for health data and the responsibility for pandemic response does not lie with the central government, but lies with, for example, regional states, that it has been much more difficult to get a concerted response that really takes us forward. So countries will have to go back over their pandemic response plans in great detail and see how they can get the command and control system in place and get all the actors together. The other strong recommendation from the group was we need to work much more with the One Health concept and see the importance of the human-animal environment interface if we really want to move forward. And therefore, many of the environmental global conferences that are taking place this year also will have a high relevance for being prepared for the next pandemic. We've already heard how important it is in terms of effective governance mechanisms to have transparency from governments, to have trust in government, and to have trust in scientific evidence, and to be able as a government to transform science into policies that can be implemented. And we discussed in the panel how difficult it was in many cases for governments, for political reasons, to follow the recommendations of the scientists. So if we highlight 3 issues where we failed, we actually have to say, and this is in relation to revisiting the foundations of multilateralism, we clearly as a world have failed in collective action. We failed on coming together to produce global public goods, and the present squabble and fight and race over vaccines is an ultimate example of that, and the lack still of support to COVAX as a mechanism to be able to vaccinate the poorest countries. And our world has failed to build a strong multilateral system that holds us all together. And this, of course, relates again to the strength and the role of the World Health Organization. We discussed a number of detailed issues that I won't go into detail here, but one example that was put forward by our group is the importance of the international sharing of pathogens, and a system that has been established for pandemic influenza is actually a system we also need for other pathogens, outbreaks, and pandemics. The WHO BioHub is seen as a new mechanism of governance that can take us forward there. So I'd like to end with 4 key messages that came from our panel. One, and that is, if we can go to the next slide. One is obviously that also in terms of governance, we need to use much more the new technologies that are available. We need to ensure data reliability and comparability around the world to be able to learn from each other effectively and to have real-time data also for a global response. We discussed very much the extent to which we're all dependent on one another, and therefore all the issues that I raised around a strong WHO and the implementation of the international health regulations is absolutely critical. Third was a critical comment from the panel that we cannot assume that there will be greater collaboration after the COVID-19 pandemic. We really have to do a very in-depth analysis of how multilateralism is functioning and how we can bring it forward. And that relates to our 4th point. If we want to avoid the cycle of panic and neglect, we need to sustainably invest in preparedness. As you might know, there are already initiatives of the G20 to actually go forward in this respect. But most importantly, and the Director General of the WHO said that recently, we perhaps need a new framework to work together. There has been the suggestion of a global pandemic treaty, a treaty that addresses some of the political issues that our panel highlighted, the collective global goods issues and the cooperation issues. And one of the strong recommendations is to reflect to which extent the discussion and the negotiation of such a more political global pandemic treaty can take us forward. Thank you very much.
Thank you, Ilona, for reminding us about the importance of politics in governance and in moving ahead, and also reminding us again that the local level is where the action really has to be occurring. And also we need to, as we think in the future and in the present, think about sharing of pathogens and some of the examples we've had in the past and how we might move forward in that, and possibly even eventually a treaty. But before we start with that, I'd just like to ask each of the panelists one question or reflections on one issue, and that is on vaccines. We've really seen an incredible number of vaccines being developed within a very short period of time. And I just wonder if each of you, starting with Mandeep, could talk about how you see vaccines in the lens of your panel discussions. Mandeep, it would be in the lens of inequalities. Sylvia, it would be in the lens of infodemics and especially of misinformation about vaccines. And Ian, it would be something about how you see we can be prepared for this continuing need for vaccines and possibly even newer vaccines as we go along. And finally, Ilona, if you could speak a little bit about global governance mechanisms, including the COVAX facility and how you see that evolving. So let me start, Mandeep, with your discussion on how you see vaccines and inequality playing out in this pandemic.
Thanks very much. And I wanted to really also thank the other colleagues on the panel. The presentations were super. So rich and so much to think about. In terms of inequalities in vaccines, I think we're seeing the inequality play out right now. You know, I think the majority of doses, like over 98, 99% of the doses have been delivered in high-income countries and starting in middle-income countries. And I think other countries are being left out completely. So I think there is an urgent need for a global mechanism to ensure equitable access to vaccines. I mean, just this week, we heard that South Africa paid twice of what other countries are paying for procuring a vaccine. So I think there's a need for a global compact, a global mechanism like COVAX. But I think COVAX needs to be ambitious. Quite frankly, I think 20% COVAX's ambition of vaccinating 20% of populations is a good start, but you know it's going to create an even more of an inequity if we don't raise our ambition there. So that's one point. Secondly, I think we need to really quickly start looking at data on vaccines. And what do I mean by data? I think there needs to be a global dashboard that is easily accessible to all, which tracks manufacturing capacity, supply, price, and then that's at the global level so that we can really see who's getting what and what they're paying for it. That will help to reduce inequalities. Secondly, the dashboard needs to really go down to the subnational granular level on who's getting vaccinated and how quickly we're going. And I think that is really essential to deal with the kind of inequities that we're going to see rolling out in the rollout of the vaccine. So I think data can help us. I think we've got amazing digital and technical tools. University of Oxford, Max Rosser is doing some exciting stuff where he's tracking, he's tracking vaccines at a global level, sort of countries and how countries are doing in terms of vaccinating their populations. But I think we need to go deeper into the subnational level. So use of data is critical. I think there needs to be transparency in the deals and the manufacturing and the supply and I think we need to urgently ramp up COVAX and get the vaccine. And I really feel like if we really want to make a difference, the people at the greatest risk who are the furthest behind need to be vaccinated first, really. And I think health workers, as Dr. Tedros is calling for, who are putting themselves on the line every day, also need to be vaccinated as part of that early cohort of people. And finally, I mean, I think for me, the observation is that the vaccine rollout has demonstrated the fragility of our health systems. Also, it's demonstrated the inequities and how inequities in health systems play out. But the inequity is not inevitable. With deliberate action, and with deliberate, targeted, data-based outreach, that can be dealt with. So I think that's my message, is that inequity is not inevitable. There are data-informed, rights-informed actions that we can take And we should learn from what happened with HIV and HIV treatments in the early days. You know, we know what to do. The political will needs to be there to do it. So I'll stop there.
Thanks, Mandeep. Let me turn to you, Ilona, because we were talking about COVAX now, and we also heard how important it will be to have surveillance systems and biobanks and whatnot to go along with our vaccines. Can you tell us a little bit about your vision of how COVAX can really finally attract membership that is willing to work through it, and also how you see the biobank that the Swiss government is promising to WHO, how you see that moving forward?
Well, David, first of all, I'd like to underline and agree with many of the things that Mandeep said. And actually, she already gave elements of issues that could be part of a global pandemic treaty. Because I think, you know, in terms of COVAX, we need more than an institution, in a sense. We need a political agreement. And in terms of COVAX, you know, it was an initiative where others were asked to join, obviously a voluntary initiative. And I think as we move forward with a view to future pandemics, we are going to need some responsibilities. We need a type of agreement on vaccine sharing, on knowledge sharing that binds countries in new ways. And that also means we have to revisit the agreements at the World Trade Organization, for example, around intellectual property. We need to revisit the PIP framework and, you know, who actually owns what. In this whole thing, we need to look at genetic sequencing, and that's, you know, also the whole issue of the biobank, the sharing. I think the biobank will need to be approached much more in a hub kind of initiative, so that many global actors are involved. And I think one thing is happening, David, that we haven't spoken about enough. Even in the whole vaccine debate, there was a kind of assumption most of the vaccines and the best vaccines are going to be produced by the wealthy countries, by governments in wealthy countries. But what we have been experiencing is a tremendous scientific development in middle income countries, in powers like China and India. And we have seen, you know, while one part of the world, like the US and Europe, has been, you know, sort of hampered and wondering how much should we really share. Obviously, they have helped finance vaccine development by investing public money into the research, but so have India and so have China. But India and China are already using the vaccine situation to build geopolitical alliances. They are out there, China along its Silk Road, India building in competition to China, friendship through vaccines in its neighborhood. And I think that's already also showing us something also in relation to COVAX. Because COVAX, of course, has a very strong focus on reaching the poorest. At the same time, we're seeing a geopolitical drive in parallel to COVAX by the middle income powers, not by, you know, the rich ones. They're not yet willing to share. They're fighting each other like the EU and the UK. So I think an enormous power shift is taking place. And it's got to be reflected in any new treaty and any new construction of COVAX, because we would probably want COVAX to be something like a new kind of organization shared by many. And that means, you know, we're no longer talking East-West or rich-poor or developing. We are really only now starting to learn what a global collective effort really means. We don't really know how we want to define the global public good. And I think that is the challenge. And we don't really know yet how we want to finance it. And that, of course, is, and I'll stop there, why the G20 has, this high-level group of economists that is looking at this question and trying to help us, and why the World Health Organization has a new Economic Council on Health for All to say, how do we jointly finance global public goods? And there is nothing that is more of a global public good than a vaccine, particularly if it's for everyone and not, as in the past, just for children, in quotes. Thank you, David.
Yeah, thanks, Ilona. Ian, I'm going to turn to you next, because we've heard, number one, about the importance of vaccines as a soft power tool in moving ahead, and we've seen how that's being used. But also more, we've heard about a treaty that Ilona has mentioned several times. What do you think, as you speak with us, I'd like to understand what you think about a treaty for preparedness, whether or not you think it will be more effective than the treaty which is underpinning the international health regulations. Because they're a treaty in many ways that has been highly criticized during this pandemic. And I just wonder if you can weave these things together as you talk about vaccines and preparedness.
Thanks, David, and really interesting questions. And obviously we're at the stage in this pandemic when we have still a huge amount more to learn, and that if we, in a sense, prematurely run into deciding what we need to do for the long term at this point in time, we may not end up with the best solutions. There is a lot more to be learned, and particularly I think in this area of vaccines, because I think there seems to be a sort of an idea around, many people have, that now that vaccines are coming on board, the problem's solved, we'll all get vaccinated, the pandemic will be over, life will go back to normal, coronavirus will disappear by the end of this year. And that's, it's clearly, that's just not the way it's going to go. And it's quite possible that we're going to end up with an endemic coronavirus disease that we're going to have to live with and manage and deal with for many, many years to come. Which has an impact on all these issues, and particularly at the moment in terms of vaccination. There's no doubt that if we end up with a long-term endemic disease, we're going to have to look at what is the program for coronavirus prevention and control, and what does that mean in terms of vaccine policies that are going to be we're going to need to apply for next generation even, and that we've got to think about that now. Because when we start thinking about these potential treaties and so on, we've got to think about the future that we don't yet know what it's going to look like. We've got to make sure we don't lock ourselves into solutions that are great for this moment in time, but are really not going to be sufficient for the future. When the idea of the treaty first started emerging last year, late last year, the focus very much was around what countries needed to do together for preparedness. And it was looking at strengthening, really, the international health regulations. I think the conversation has changed. This year, the focus is almost solely about access and equity. And if there's a treaty comes out that's looking at just a response in terms of strengthening the response in addition to the IHR, and it doesn't focus on access as well, or even put access front and center, I think it's going to actually, I don't think it'll succeed, because I think that's where the current concern, the current pain is being felt. And we've got to be able to respond to the current pain as well as the future needs. So I think that this idea of a treaty, I think we all think the idea of a treaty could be very helpful as a supplement to the IHRs. But I think that many people are going to be saying it's got to be a treaty that ensures that we get equitable access to to public goods, to common goods that the world needs to deal at a global level with a pandemic in a way that ensures that there is equitable access. And what I think we've seen is that the way that we currently do innovation, or the way that we finance innovation, the way that we deal with innovation, doesn't actually think about the access until a little bit too late. And that what we need to do is look at innovation for equitable access, and not just start thinking about access once we've got the tools have started to be developed. I think that's one of the key lessons learned from this pandemic.
Thanks, Ian. So really, a new treaty might compensate for the lack of access that's been promoted through the IHR. And it's a good way going forward. And hopefully we will have the vaccines. But Sylvie, when we have those vaccines, and we do have them now in many countries, how are you going to make sure that the infodemic around false vaccines and false information rather about vaccines does not overtake our ambitions?
Yeah, thanks very much, David, for this very important question indeed. And I would say, despite the fact that we have been thinking about it since many months, we are still surprised by what is happening on a day-to-day basis, and how, I mean, we need to, when we observe the world, we realize that we have to learn a lot, even nowadays, and adapt our ways of doing things, because all what was planned basically is not working very well, and we really need to adapt our approaches currently. Let me highlight the context of this communication. First, it's a very emotional context, because there is first a lot of hope for vaccine, but also it happens in a context where we are still responding. So a lot of fear, a lot of anxiety, still many people are dying. And so a lot of families are mourning and are still, I mean, their perception of risk and about the tools and the countermeasure is very different from what it is in normal time, basically. The second thing is the context of this communication is, as I said, that the science is evolving very fast. We have not only many products in the pipeline, some of them have obtained emergency use authorization, but are still somehow in the phase 4. We are still learning on those vaccines, and there are different products with different platforms. And we have the variant now also that can put at stake the efficacy and the effectiveness of those vaccines. So people are bombarded with a lot of different information, and the majority of the population is not necessarily aware of the vaccine, because it's a vaccine that will be applied to adults, while most of the vaccines are usually applied to kids and children. And so this is something new for most of the population, and this debate and this thinking is also very new. Finally, I think we are also in a very difficult context in terms of vaccine, because there is scarcity, not enough products. So in some places there's very high demand, in other places there's no demand at all. And so for decision makers, it's very hard, because they try to make plans, and their plans are often contradicted by the reality and the behavior of the population. But in any case, in this context, they have to make political decision on who to vaccinate first, how to do it. Is it through mass campaign? Is it through a general practitioner? How are we going to carry out this vaccination? And so there are lots of decisions to be made in a context of uncertainty, scarcity, and a very heavy context of communication as well. And finally, I think many people have considered this vaccine or vaccination as a vaccine introduction, and they use the same approach that they used for other new vaccine introduction. But again, given this context, I think the communication is much more challenging. And so we have to really understand that to find the right way to do it, because also in this particular context of pandemic, it's not only the vaccination for yourself, I mean, to protect yourself. Vaccination also a dimension to protect the others. And so this double, I would say, double symbolic use of vaccination is also very important, because it makes the communication very difficult sometimes. So I think what we have learned, at least since the beginning of this pandemic, is that even if these are new vaccine and we want to rush fast to share information, we need to put communities at the center and start engaging communities. Because if we just use the top-down approach for communication, I think it will not work as well as we expect. Because it's because of the emotion, because of this complexity. I think it's very important to engage people and engage in a dialogue as well, a two-way dialogue with a lot of transparency. Because you have the information that is provided by the vaccine manufacturer, information provided by scientists, but there is very few places where you can discuss all those type of information, question them, and I think there are legitimate concerns of the population. There are fear about those new vaccines, so it's very important to create places where those questions can be asked, can be answered, without immediately, when people ask a tricky question, making them or describing them as adept to conspiracy theories. People want to have more information, and we need to make sure that they have this information in real time. So transparency and evidence, I think it's really important and should be at the core of this communication. So needless to say that many partners have engaged in mass campaigning and very active communication. But we need to combine this also with engagement of people and listening to their concern, especially in this time where concerns are many. Thank you.
Thank you, Sylvie, and thanks to all of you for your views. We have some questions from the audience, but before we turn to them, I'd just like to ask each of you in the next 10 minutes until this session is over to be thinking about one activity that you would like to see started tomorrow to deal better with the current pandemic. Not looking to the future, but looking to the pandemic today. What is one action in the areas that you've discussed that you would like to see begin tomorrow? And so while you're thinking of that, I'll come to a question by Sabine Lin, who's in the audience. And she's asking a question about community leadership, which we've all heard you all say is very important. And her question is, how do you locate that community mobilization leader? Or how do you locate someone who can help lead the community onwards? And so maybe I'll turn to you first, Mandeep, and then over to Alona and Ian and Sylvie for just a short answer, if you would. Mandeep.
I mean, I think there are community leaders, in all areas of life. There are people working on labor rights. There are people providing access to services, providing information. I think we need to really bring together community leaders and engage them effectively in the design of COVID. COVID mitigation and response plans and recovery plans. So without the community engagement, there's a real risk that we will not have the kinds of responses that meet the needs of the communities. So we have a lot of experience on how to engage communities from the HIV epidemic. And I think there's a lot to be drawn on there. There are a lot of community health workers, for example, civil society groups. The big problem, of course, is that we're seeing a trend over the last couple of years of shrinking civic space. And that, anything from reductions in funding for civil society groups, lack of space for the inclusion in national responses or local responses. So I think we know what to do there, and there are activated community groups out there working on health issues who are ready, willing, and able, I think, to be engaged. We just have to do it. I don't think we need to build sort of new community leaders. They exist, and I think they're already out there doing a lot of the work on COVID. And I think we just need to engage them respectfully, meaningfully, and make sure they've got the space and the resources to do their work.
Okay, so understand the community, and those leaders will be there.
Yeah.
David, if I can just add something,
Yeah.
I think, we do have 35 years of experience of health promotion in working with communities. Think of initiatives like Healthy Cities, health promoting schools. We have, a whole range of approaches, obviously, in both developed and developing countries. And what I have found so sad is that experiences in one context, which perhaps were more related to non-communicable diseases, but the strategies are the same, were never called upon for the infectious disease. And the other way around, that many of the professionals in health promotion didn't make that leap into the health literacy that is important in relation to COVID-19. So I think what we have to do is also bring this sectioned off areas within health, where in every area there's community experience, there's leaders, there's organizations, and say, let's pool our knowledge, let's move forward together. And if COVID-19 can help us on that, rather than like during the Ebola outbreak, one suddenly said, ooh, we have to find some anthropologists, rather than build on experience that was already there.
Thanks. Ian, briefly, any views on this?
Just to build on what Ilona has just said, and I think this demands really, it's much bigger than health. Engagement with communities is something that's got to be across every aspect of governance, of politics, of culture, and that you don't deal with it by just having for example, community engagement around pandemic preparedness and response. It's community engagement. It's got to be across everything that the government does and that the country does in order for this to work effectively. And I think we're seeing that in countries where there is really where people are viewed as individuals and individuals alone, and it's the rights of the individual that are paramount, rather than the ability to work in community whilst retaining those rights. That is so critical in ensuring that we are able to deal with the existential crises of this nature.
Thanks, Ian. So communities exist at all levels in all different groups. And Sylvie, finally, just a quick word because we're running out of time. And then I'm going to turn to Ilona and ask you to please give your one way forward. So Sylvie.
Yes, I think my co-panelists have said most of it. I would just to add just a few things is that we need to add communities of practice. Because, for instance, we have engaged communities like the communities of hospitality service, faith-based communities. So I think we have also to innovate in the way we see communities. It's not anymore geographic communities, but really across the board, because with new tools, actually, borders and geographic are not anymore enough to define communities.
Thank you. I think that's a good point. We're a globalized world with an internet that links us all. So Ilona, back to you. And this is just your wish about one activity that could start tomorrow that would change this pandemic.
Well, you know me, David. I think what is important is that people understand public health, that we stop looking just for one. Because one of my great worries has been that everyone's been looking for one activity, one silver bullet. Let's have a lockdown, let's have a vaccine, let's have this. And since I live in Switzerland, I'm a big supporter. If everyone were to adopt tomorrow the Swiss cheese model of pandemic preparedness and response, I would be the happiest person on this planet.
Okay, so we need to be looking at all the risk factors and make sure that we stop them from lining up and continuing the pandemic moving forward. Ian, over to you.
Do what Dr. Tedros has called for, every country to begin vaccinating health workers within 100 days. And I say that because I fear that if that doesn't happen, we're facing a real crisis in the multilateral system. I think there's a real danger that the world is in a sense going to fragment unless we can demonstrate that there are ways of ensuring equity. We need to do it very urgently.
Fulfill our obligation to equity. Thanks. Sylvie, your final action.
I think I've been very honored because I was asked by my supervisors to take care of the development of this biohub. And I think I see this as an opportunity to shape new ways of collaboration. So it's extremely challenging. I remember you were involved in developing the PIP framework. It has been a very long road and painful at times. And I anticipate it will be the same. But also I have a lot of hope that we can build new way of collaboration, even in this world, which is really fragmented. So, yeah.
Thanks very much, Sylvia. And Mandeep, your final, and then we're going to talk about the next session. So Mandeep, over to you.
Yeah, mine is the same as Ilona's, that I think we need an immediate, across the globe, a full-on commitment to the public health measures to prevent COVID, because I think there isn't going to be, even with the vaccine, if we vaccinate everybody tomorrow, we still need the public health measures. So I think we need clear, concise communication and political commitment to the public health measures to really mitigate and prevent and control this in an effective way.
So thanks very much. Well, thanks to all four of you, Ilona, Ian, Sylvia, and Mandeep, for a really interesting panel discussion moving forward. Thanks for having run those parallel sessions in your webinars previously and having participated today.